What would you like to see in improving the hospital discharge process?
I would like to see some person assigned to the caregiver to be able to help the caregivers understand what the healthcare team is talking about, find out what's on their mind, what are they worrying about, what information do they need, how can they be helpful in getting ready to take this person home or to a sniff. More attention paid to the caregiver as an important part of the healthcare team in the hospital. And obviously, it would be great if there were more, a little more time, a little more, so that the pressure to discharge was not so intense that somebody might need just another day, another 2 days, and they would be in much better shape, so that people aren't discharged when they're really just, maybe they're, not, still have effects of anesthesia. So, give people a little more time.
Right.
Would be helpful.
What would you suggest?
I think it would be cool for a discharge planner to require a non-medical home care professional to help coordinate as a concierge for that person's individual coordination once they go home. We are part of that care team. We can help when friends and family cannot be there for things, and we're there to help really drive down the chance for readmission. And people who have made choices to move forward without us, not everybody needs us. I just think it's overlooked, and people are overreactionary when they're calling us. So if it was considered up front as a requirement, I think it would be a great assist.
I think that besides caregiver education, I think sensitivity training is really the key to helping the discharge process, because when you're trained to think of the problems that caregivers and patients face, you'll automatically think of things that will help them, and understanding their plight. I've mentioned many times throughout this episode that medical staff and hospital staff are often overwhelmed, and they just want to get everybody where they got to go. But I think the whole thing of sensitivity training is very important. So our last question is, what advice would you guys give to patients and caregivers who find themselves just overwhelmed with all of these different connecting parts?
I would say find someone you can talk to who understands, who's maybe been through it, or is a professional that could be a friend or family member, and say, I just can't deal with this, help me get through it. You need to talk it out with somebody. And I think it's not therapy, it's just having a sounding board and having someone say, well, in this case, I would recommend that you do this, or, that's just going to be the way it is, let it go. And I think that's the idea is that this too will be over, but then you're going to have to deal with the after effects of it. So try to minimize the stress that you feel while you're going through it.
Absolutely.
The first step would be to listen, give people a chance to do what their job is, and pointing you in the right direction as you're analyzing it all and piecing it together. And then you do just need to pick one person to trust. So I know, for example, if you did choose to start with home care, we would be a good starting point. If you called us, I know that even if I couldn't help somebody, I would know other professionals in the community with whom we've worked that I could then say, nope, you're almost here, but you should. It might feel like a runaround, but I don't want to hang up and not help somebody. I think other people in this profession feel the same way. It is a little bit of a maze, but we're all working together and want to see that person do better.
No, that's great, Craig. I often get calls from out of the blue from people, states far away. They find my name in something, and I always listen and I say, you know, I'm sorry you're going through this and I can't help you, but have you tried? And I give them the name of one organization that might be able to help.
That's right.
So that I don't send them away without something, another place to go.
Exactly.
But I can't, what do I know about
You
those
have to
things?
pick what seems like the best starting
Yeah,
point
yeah.
and just hope that that person on the other end is going to help you.
Yeah.
Absolutely. If I could give any piece of advice to overwhelmed caregivers who are undergoing the discharge process, I would just tell them to stay grounded and don't get scared. Because when you get scared, you'll make bad decisions, you'll burn out, and everything won't go as well,
Yep.
you know. And so it's important to just stay calm, do your research, reach out to as many support groups and your medical staff, make them your friend, and just proceed on, you know, through the problems. So thank you guys so much
Thank
for
you,
joining us
Jas.
today.
Great, thank you.
And we have to have both of you back sometime.
I'd be glad to do it.
Only if I come with Carol.
Absolutely, absolutely. We'll be right back.